This fall, the Shaker Heights School Board announced that a fifth grade teacher at Woodbury Elementary School had been diagnosed with the AIDS virus. In response to the first documented case of AIDS in the Shaker school population, the Shaker Heights PTA, in cooperation with the school administration, presented an informational community program and panel discussion on AIDS. The following Shaker Life program will be highlights of that November PTA meeting.
Let me start out by saying that this disease is new. You've heard it, and it's true. At least in our country, it was not until 1981 that we first even had an inkling, a suggestion, that we were dealing with a terrible illness. In that year, in the summer of that year, physicians reported to the Center for Disease Control a half a dozen cases of two very unusual illnesses. One was a pneumonia that we have seen over the years, but only up until that time in very sick patients with cancer or who were on chemotherapy, who had suppressed immune systems. They also reported in that summer an unusual form of cancer called Kaposi's sarcoma, which in recent years had been seen in that same type of individual, very sick, ill people that were undergoing chemotherapy, had very suppressed immune systems. What was so unique in 1981 was that the individuals that had these conditions were totally healthy young men who happened to have gay lifestyles. This prompted the CDC to call on all physicians to report similar cases. And indeed, they could trace cases back to the late 70s, but not much further than that. And in the first year of active case reporting, approximately 2 to 3 cases per week were reported to our nation's headquarters for communicable disease. Today, it's not uncommon to see 600 or 700 cases or more being reported per week. Despite the fact that this disease is very new, tremendous progress has been made. And I throw this slide in here to show you that this is a photograph of the virus that we now know causes this disease. In the beginning, it was very mysterious and very scary because we didn't know what causes it. We do now. The virus is referred to as the human immunodeficiency virus, or HIV, and I will refer to it as HIV for the rest of our discussion here. We know more about this virus than any other virus on the face of the earth. So for those that want to know, what are the questions and answers about this disease, we have a lot of scientific information. We don't have it all, but we have a tremendous amount from which to draw on. The virus can be grown in the laboratory. We can test drugs to see if we can come up with one to defeat it. We have materials available to try to develop a vaccine, yet not a single patient has been cured of this disease. And in its fully developed form, it is indeed a totally fatal illness over an extended period of time. So we have a long way to go. I want to spend just a minute or two to tell you what we refer to as the pathogenesis of this disease. That means how it works, because it's particularly devious. Before I go on, and if you have the notion that there are some technical things that you may hear and you may not need to know all this, I have a basic tenet from which I speak about this disease from, and that is that each and every individual in our society needs to know about this disease. They need to know about it. For the vast majority of people in our society who are at absolutely no risk for this disease because of their personal behavior, they still need to know about it because they will be called upon, as you have been called upon, to make the difficult decisions for schools, businesses, workplaces, etc. And for the rest of the population who is at some finite risk, whether they're heterosexual or homosexual, they need to know those things that can save their lives. And that includes our next generation, our young people in our community. So that is why we're going into some of the things that we're going to be going into. The virus works in a particularly devious way. Ordinarily, when we are attacked by infections or other outside invaders, we have an immune system which protects us against it. It repels the invaders. This virus kind of goes around that system by attacking the immune system itself and disassembles it. So in the final stages of the disease, people develop a wide variety of infections or cancers that have taken advantage of a defenseless host. And that's why we call these opportunistic infections or opportunistic malignancies. So most people who succumb to HIV actually succumb to a complication of the virus. Unfortunately, we now know that the virus does some other things, and if individuals survive long enough, or some individuals, because of some genetic features, develop severe involvement of the neurologic system. And we're now seeing a young population of people that have Alzheimer's-like illness, except for they're in their second and third and fourth decades. So it's a very devastating type of illness, and it can do a very devastating job at making people sick and killing them. Now, some definitions are important. There's a lot of loose talk in the newspaper, on TV, when you hear about people who have AIDS, people who have the virus but they're not sick, people who have an antibody, people who are carriers. These terms need to be understood if we're going to use the vocabulary of this disease. And indeed we will, because this disease will be around for the rest of our lives. AIDS refers to those individuals infected with the virus who are most severely afflicted. Their immune systems are profoundly compromised, and they have one of a variety of serious opportunistic infections or cancers. These individuals have the worst prognosis and rarely can remain productive in our society for very long, if at all. Fortunately, as with many other infections, not all individuals infected with HIV develop the same problems. And at any given time, only about 5% of people infected with this virus have AIDS. A larger percentage of people have an intermediate syndrome that we kind of loosely define as AIDS-related or AIDS-related complex, or ARC. These individuals are infected with the virus, they're somewhat immunosuppressed, they really have not developed an opportunistic infection or a malignancy, and they have a variety of symptoms that can be very mild and continue to function, or it can be very devastating. They include things like persistent weight loss, profound fatigue like mononucleosis, enlarged lymph glands, unexplained fevers. They're ill. This may persist for many, many, many years, or it may progress to AIDS. Or again, it may remain stable. And some of these people can be very viable members of our community. This represents about 15% of people. The remainder of people infected with HIV are healthy carriers of the virus. Indeed, they are infected with the virus. They are slightly immunosuppressed, but they are robust. They have a normal examination. They continue to function. They should continue to function. We know that if you carefully screen individuals who fit this category, at the end of 5 years, over 90% of them are still healthy. But unfortunately, with time, some of them will develop ARC and some of them will develop AIDS. The exact number that this happens to is really not known, but we fear that it will rise as the years go by. This paints for us a picture that traditionally looks like this, where this is the group of people infected with HIV right now in our country. The tip of the iceberg are those who have AIDS, some more that have ARC, but the majority of people are healthy. The good news is that out of all these individuals infected with the virus, the majority should continue to live long and healthy lives, at least over the near-term future. The bad news is that not only will they continue to develop complications, some of which are fatal, each and every one of those groups is equally infectious on a sexual or intravenous basis. This number at the present time is between 1.5 and 2.5 million people by the best estimates that I have seen. If we take a low number of 1.75 million, that means that in our country today, approximately 1 out of every 100 adults is carrying the AIDS virus. So for those individuals that think that they can hide from this and go someplace, or go to a school district that's unaffected by it, or a place of work, or a community, or a state, or a country on the planet, it's just not true anymore. The genie is out of the bottle. So we have to learn how to address this in a rational manner. Fortunately for us, many things have remained the same, and that has to do with the distribution of those most afflicted by the disease. If we look at 100 people now and we compare it to 100 people in 1981, it has not changed. 3/4 of these individuals are gay or bisexual men who have transmitted this or become infected by a sexual route. 15 to 17% are intravenous drug abusers. 1 to 2% have developed this through contaminated blood and blood products, while 4% have developed this through heterosexual transmission. This is a disease that is for everybody that is sexually active. It is a virus. It doesn't care whether you're a homosexual or a heterosexual. It's transmitted from man to man, man to woman, woman to man, and even in a few cases, woman to woman. It doesn't care if you're black, you're white, what religion you are, whether you're undereducated or have a lot of education, whether you're poor or rich. It is a disease for everybody. It is not branded to any one group. And I think you understand this. We need to know about the issues of transmissibility, and I'm going to go into them in a minute, but I want to bring up to your attention the remaining group, a few percent, because these data have been twisted by some people to be overly alarming. There are about 3 to 4% that represent a miscellaneous group. Some are children with AIDS. This includes a large percentage of this group who were too sick ever to give any history of how they may have contracted the illness. And that does leave 1 to 2% where the risk factors are unexplained. And many people have said, well, you don't know how this is transmitted because you can't explain this in every single person. Realize, in the first place, the issues that reflect transmissibility in the majority of people are homosexuality and intravenous drug abuse, which are things that we as a society look down upon. And there is a great incentive for people to withhold this information. Yet when we put professional epidemiologists, people that do this type of work, on these cases, 80% of them can immediately be reclassified to a previous risk group. Of the remaining, 95% are men and 5% are female, just as the entire group is in this country at the present time. And this has remained very steady from the beginning of the epidemic until now. It's not found people in restaurants becoming infected, people working around swamps and mosquitoes, people in random positions. It has not happened, and this is an important piece of data that we all need to understand. This is a very scary slide that I have to show you because it tears us. I am here to tell you tonight that this is a disease that is terrible, that represents the first and real risk to the public health in many, many years. It is a disease that concerns me as a physician and as a citizen. But it is not a disease that I worry about personally because, as I will tell you, it is a totally preventable and behaviorally transmitted disease. But we know from this graph, which tells us the number of people that have been reported up to now, those little blue lines on the bottom represent numbers of individuals who have been reported with AIDS every 90 days since the beginning of the epidemic. And right now we have several thousand people every 90 days being reported. In 1981, we had a few scores of people. By 1991, based upon hard figures and facts, we know that every 90 days, between 12,000 and 25,000 new cases will be seen every 3 months. The worst tragedy of this is that those individuals who will be diagnosed of AIDS, the tip of the iceberg at that time, are already infected with the virus. And therefore, no matter what they know, or no matter what vaccines we produce, if and when we produce one, it will not help them. Hopefully a drug will, but the problems with this are great. I respect you all for being here because I know that you all have children in school, and I have children also, and I am concerned for them. And I'm concerned for them because they must grow up and awaken sexually in a very different world from which we have grown up in. And I think that the information on transmission is critically important. Important for you to understand from the viewpoint of their personal safety, but also for their personal risk. And I think that these are issues that I know that your school system is taking up right now on how to impart this information to this next generation. This disease is transmitted in 3 ways: by intimate sexual contact, by blood-borne inoculation, and from the infected mother to the newborn. I can speak authoritatively about this because this transmissibility data is supported by a large body of experimental information, which I'm going to share with you, because the last thing in the world you need, and the last thing in the world that I would ever intend to do, is come here to sell you something. There's no one in this auditorium, I think, more concerned about the personal risks of casual contact and AIDS than myself, since I'm clearly the most exposed person here. So I take care of hundreds of patients with this infection. I'm not selling you anything, I'm sharing information with you. You interpret it as you will. There are at least 3 or 4 lines of reasoning that tell us that this disease is transmitted in this way and no other way. They are based on a very powerful blood test that we have that identifies individuals infected with AIDS. Using this very powerful blood test, we've gone into hundreds and hundreds of households across the world. The most famous study done in New York City, northern New Jersey, by Dr. Friedland. In those households where an individual was infected with HIV, they tested everyone else in that household. Sexual partner, non-sexual partners, siblings, children, boarders, etc. They determined how these individuals contacted each other on a day-to-day basis, and many of these were done in northern Jersey, South Bronx, very crowded, often squalid conditions. They found that these individuals frequently shared knives, forks, plates, cups and glasses, towels, bathroom facilities, toothbrushes, razors, combs, and brushes. And in these studies that have been going on for the past 3 years, which the data has been updated at the international meeting, although you never hear about it very much anymore, there is yet to be a single case of infection to other than the sexual partner. And even among sexual partners, only about half of them become infected after even hundreds of direct sexual contacts. So that's interesting, and it's something that we should take note of. Similar studies have been done in Africa, in hospitals, where there are hundreds and hundreds of patients among healthcare workers. A second type of study has been done among daycare centers, and I think this is even more important for our children. Before 1984, we didn't know about this virus. Yet there were infected babies and toddlers with HIV in nursery schools. And in one French nursery school, half of them were infected hemophiliac children. And in these studies, looking at other toddlers and the foster mothers in those settings, where routine care has been administered, nurturing, changing diapers, and hardly the contact between toddlers should be considered casual. Believe me. There has been no demonstrable transmission. A third line of study, because we are always talking about the viruses in blood and semen, but we've all heard that it's occasionally found in dilute concentrations in saliva and tears, and what about, when someone spits on my child or something like that. In the dental clinic at the San Francisco General Hospital, where dozens of dentists and hygienists worked for several years before they donned the gloves and masks that our dentists should be using at the present time, and in a clinic where they literally worked every day in the mouths of HIV-infected patients for years, bathing themselves in this supposedly infected saliva. Not a single healthcare worker who was not in a high-risk group themselves has ever seroconverted in that type of setting, telling us something else. Lastly, all the studies done in healthcare workers tell us that indeed this poses a risk to healthcare workers in the hospital, but it's a very small risk, and it only comes to those who have punctured themselves with needles that have been inside patients infected with HIV, or who have suffered significant exposures to the mucous membranes to massive amounts of blood. It tells us that we need to be careful, but in comparison to other serious infectious diseases like hepatitis, this is hundreds and hundreds of times more difficult to transmit. There are many reasons for this, probably because hepatitis travels in the blood in concentrations of 10 billion to 100 billion particles per cubic centimeter of blood. The AIDS virus travels in concentrations from 10 to 100 or so particles per cubic centimeter of blood. So therefore, blood spills and bodily fluids have such a small amount of virus that it is generally considered below the threshold for infection. Yet it can be transmitted by sex, heterosexual sex, experimenting with drugs, and from infected mothers to their newborn. And this is where the real risk of AIDS is to our next generation. It is not transmitted in any other way, and therefore the policies that have been set down by the Center for Disease Control for our schools and workplaces say that this is no threat to us, and we should let people who are physically able, yet who are infected with HIV, go about their business. The last thing that I will mention to you is something that you also know about, and that is that I've just discussed with you a very terrible infectious disease that's going to kill hundreds of thousands of Americans, if not more, and millions of individuals worldwide before we turn the corner of it. However, at the same time, there is another disease that is spreading over this country, and it's an epidemic of fear, founded mostly in superstition and sometimes complicated by bigotry and hate. And you don't have to look too far in this country to see how communities respond, such as in the tragedy of Arcadia, Florida, where concerned parents for their children, genuinely concerned and wanting to do the right thing, let the situation grow into hatred and bigotry, culminating in the firebombing of sick little boys' bedroom. And I suggest to you that that type of community response is symptomatic of a disease far worse than AIDS will ever be. And it needs to be addressed and stopped now. I think that your community response has been exemplary. And I think that one of the things that this disease is doing to us as a society is that in all the darkness, there is a chance for greatness, because it allows us as individuals to look within us for the compassion that we really need to express. And it allows us as communities to become leaders in how we are really going to address this problem.
Dr. Susan Shuren, Chief of Hematology and Oncology at Case Western Reserve University and a Shaker parent, made 3 major points in her speech. Suppressing the spread of the AIDS virus requires personal behavior changes. Society condemns homosexuals and drug abusers, 2 high-risk groups for contracting the AIDS virus, and there is therefore no incentive to come forward for testing, and there's a fear of admission. We should therefore look for social and community incentives to encourage high-risk individuals to come forward for testing and education. Paul Levin, an attorney, said that courts have concluded that the risk of transmission of the AIDS virus in a school situation to be so minimal that schools must provide education to students diagnosed as having AIDS, and teachers with AIDS cannot be discriminated against. Dr. Lolita McDavid, a pediatrician and Shaker parent, cited the October 29th issue of the New England Medical Journal as an excellent educational resource in understanding about the transmission of the AIDS virus. She also noted that in this era of the AIDS virus, responsible sexuality is of paramount importance. Deborah Paris, child therapist, dealt with the issue of how to discuss AIDS with our children. AIDS makes everyone feel anxious, and one should listen to your children's questions and be aware of your children's feelings. Establish what your child knows and feels about the AIDS virus. Be open to hear even those things you might not want to hear. Be aware that you have your own fears and prejudices concerning homosexuality, drug addiction, and terminal diseases. Dr. Peter Hroshak, superintendent of the Shaker Schools, stated that the Shaker Schools' approach to this problem will be through education, and that appropriate policies and procedures will be developed for the future. For your information, a duplicate copy of this program is available in VHS format at Bertram Woods Library in Shaker Heights. And this same program will air every Wednesday in December at 2:30, 8:30, and 11:30 p.m. on Viacom Channel 34. Thank you for joining us for this edition of Shaker Life.